Renal is the word used to describe anything to do with the kidney. Your kidneys have an important job in keeping you healthy. They do lots of jobs. They clean your blood by removing waste, extra salt and water, help control your blood pressure, tell your body to make new red cells to carry oxygen in your blood, and keep your bones healthy. When they are no longer able to do their job, you have end-stage kidney disease. You might not notice any change in how you feel until this point. Your kidney team will talk to you about ways to replace the work your kidneys do to keep you healthy. This is called renal or kidney replacement therapy. The two main treatments you can have are a kidney transplant or dialysis. Let's start with a kidney transplant. A kidney transplant is a big operation where a kidney is taken from someone called a donor and placed into your body. This new kidney can do all the jobs your old kidneys couldn't. You'll need to take good care of it by taking medicines every day, drinking lots, and keep healthy to help your new kidney work well. Children who need it will be prepared for a kidney transplant because it is the best way of keeping you healthy. So how would you get this new kidney? The donor can either be a living person or a deceased person who recently died. It was a choice made before they died. Lots of people do this. An adult, relative or friend may choose to be a living donor. They can give away one kidney as they only need one to stay healthy. They have to have tests to see if they match you well and are healthy enough. These tests can take several months. Sometimes you don't have a match in your family. That's okay. There's a kidney sharing scheme where other people like you with their healthy donors who don't match each other can swap kidneys with other pairs. How cool is that? Sometimes a stranger who wants to do a good thing decides to donate one of their kidneys. This is called an altruistic kidney transplant. If you don't have a donor, you will go on a waiting list to get a match to have a deceased donor transplant. This is when a kidney matching you is taken from a person who recently died that has agreed to give it away. Sometimes this happens quickly, but more often you will wait a few years for a match. Dialysis. Whilst waiting for a transplant, your kidney team may talk to you about dialysis, where machines do the job of your kidneys by cleaning your blood of waste, extra water and salt. There are two types, hemodialysis and peritoneal dialysis. With hemodialysis, you are connected to a machine that does the job of your kidneys through a special line or fistula. To have a fistula, you will need surgery several months before to connect the vessels in your arm. Whichever you have, blood is pumped into the machine, cleaned and then returned to you. This takes around 3 to 4 hours each time in the hospital. Most people will do this 3 to 4 times a week, and some will learn to do this at home. With peritoneal dialysis, you are connected to a different machine through a tube inserted through your tummy. Here, a special fluid fills the space in your tummy touching the inside lining called the peritoneum and lets waste come out into it, which is then drained away. This happens every night, usually when you are asleep. Your family will be taught how to set this up at home. Which type you'll have if you need it depends on several factors that your kidney team will discuss with you. Remember, dialysis is only one part of your treatment. You also need to watch what you eat and drink and take your medication and injections to keep you healthy. We hope that you have found this helpful. Please check out the links for more information.